Hey guys, good morning. Dr. Sean here. We're going to be talking about our mailbag segment today. We got asked a great question. It says, Doc, what do you think about ticks? You know, those little things that are crawling all over. They fall out of trees and they grab on the grass and they're hanging onto your ankles and they bite onto you, your pets, your children. What do you do about them, right? What do you do about ticks? So I thought we'd first focus on, where do they come from? Where do we see them at? And if you live anywhere around where we are, they're everywhere, right? They're in the tall grasses. You can get in the woods and the trees and things. And now that the weather's improving, everybody's outdoors, and so are the ticks, along with the mosquitoes and the buffalo gnats and everything else. So we know, all right, how do we get them? We're walking through tall grasses. We're walking through areas where they might be, and they latch on. Now, they tend to bite because they're kind of parasitic in nature, right? They're going to feed on you or your dog or your cat or your child in this case. So the worry with a tick is disease. Does it spread some type of disease? And ticks have been known, like mosquitoes, to spread things. Now, Lyme's is the one that really comes to mind for most people, but it's only a certain type of tick that actually spreads the Lyme's bacteria. In this case, it's a spirochete is what it is. So the question becomes, well, how often do we run into that? About 300,000 people a year are diagnosed with Lyme's disease. So it's common, but it depends on what part of the country you live in. The northern states, Minnesota, Wisconsin, all the upper East Coast, New England, Pennsylvania, they tend to have more of it because that particular tick likes to live in that environment. It does not mean it can't come here, and it has, okay? So be aware of that. The difference is really the types of ticks, and the type that passes the Lyme's disease, the deer tick, is very, very, very small. It's not what you think of when you think of a tick around here. We think, oh, okay, you can see it, you can grab it, you can pinch it off your dog. It's a different animal, all right? In this case, these guys are very, very, very little. So sometimes they're hard to detect, and that becomes the real issue because the longer the tick is on you, the more likely it's going to pass any kind of a bacteria, a virus, or something that it may have in its system. It's going to pass that to you. So when it comes to Lyme's, how would you know if you got it? Right? One of the things is something called a bullseye rash. You'll get this bullseye type rash that'll start forming on your skin. Now, it only occurs in less than 50% of the people that contract Lyme, so you can't rely on it. You'll notice that if you notice you got bit and you saw it and you pull it off, and a few days later, man, your joints hurt, you're tired, you're fatigued, you're getting headaches, chances are good something got going. It may not be Lyme's, but something. Now, the tests for Lyme's disease, they're sporadic at best and erratic at best. You know, the ELSA, the Western blot, things that medicine is used for really the last couple decades, they're really, really poor. They don't really diagnose it that well. Now, there are different microscopies you can do. There's a dark field microscopy, there's a direct microscopy that you can do, and these are trying to look in the cell itself for that specific spirochete to see if it's present. Those are probably a little more accurate, a little harder to get. There's not many people around that do those tests, so they can be a little tricky. Now, say you get bit by a tick, and you notice it's on you, what do? The CDC on their website actually gives you a way to remove these. So I'm just looking at it right now. They're saying, look, tweezers are your friend, right? So you want to get the tick, you want to grab as close to the skin level as you can and pull the tick straight up and out. Don't twist it or turn it because you can break off the head of the bite, and that will, now you got to pull that out of the skin. Anything left behind can be a problem. So you just pull it out. Now, I would recommend, if you are worried about this, I might put the tick in a baggie, a Ziploc bag. Stick it in there, keep it, and hang on to it for a few days. See if you have symptoms. If you do, I would then take that in maybe to my doctor or something and say, hey, I need to get this analyzed and make sure it's not carrying some kind of disease. Okay, so that's just a good little piece of advice there. Once you take the tick off, you need to clean that area. Use rubbing alcohol. It's easy. Right? It's one of the easier things you can do. So get some rubbing alcohol on it, good old soap and water. Make sure you got everything out of it. Okay, that's another good thing. And that's enough. That'll usually do it for most people. Now, how do you avoid getting bit, right? We don't want to use the chemical insecticides because they're dangerous to us, right? The DEET and all that the CDC recommends, it causes more harm to you than most of tick bites. So you look at this and say, well, what are some natural things you can do? The essential oils tend to be one of the dominant things here. We use a skeeter spray in our practice that we have available for people. I absolutely love it, and I'll post it up on here for you guys later. But it's one of my favorite things. It's just a blend of essential oils. So instead of you trying to mix and match 4 or 5 things that tend to repel bugs, they do it all for you. It's inexpensive, it's effective, it works very, very well. It's actually got a pleasant smell. Lavender is really good, geranium is really good, tea tree oils are really good. All these things mixed together can be used, and they're every bit as effective as any of the over-the-counter bug repellents. So that would be my recommendation. It's a great mailbag segment. I hope this helps you and your family during the summer. I'm Dr. Sean, the Robin Hood of Healthcare. Take care.